there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for your real clinical situations. We've got you covered.
And today I'm reporting from my daughter's nursery, and Kathy is comfy on her couch, and we are going to talk to you about Kegels and how they're not one size fits all. So Kathy, I'm curious what your EMR handout is like at the health center for Kegels.
Oh, Melissa. Oh my goodness. So the first thing is that if you just type in the word pelvic or like pelvic pain or pain with anything like that, literally the only thing that comes up is the handout to do Kegels. And then in that handout, all it does is talk about squeezing. And so that is incredibly problematic because now that, we're all learning how to revolutionize pelvic health, we're learning that you can have hypertonic or tight pelvic floor muscles, and that probably squeezing tight muscles is probably the worst advice that you can give to your patient.
Mm-hmm. So true. And making sure that you can have a weak pelvic floor that is tight. And so if the pelvic floor, the bowl is elevated and you're having someone squeeze, they're not going to be able to do a good contraction, and it's not going to be strong, and it's not going to do anything. So making sure that you educate about the release or that inhale, making that bowl shape. Every time you inhale, you're getting the pelvic floor relaxation. And then on the exhale, you're able to maximize the contraction because the pelvic floor is elongated and those muscle fibers are able to contract and get that good lift. So it's the squeeze, but it's also the lifting of the pelvic floor muscles as well.
Totally. And something that Melissa and I talk about a lot is that bicep analogy, right? And that you can't, you can't squeeze a muscle that's super tight, right? Like you have a resting amount of tension in your pelvic floor. You wanted to have your pelvic floor muscles have full range of motion. They can contract and they can fully release. And so the problem is that when they're hypertonic, it's almost like they're sort of stuck, right, Melissa? Like almost in that like super elevated position.
Yeah.
And so the best thing that you can do for your patient is to get them to breathe so that when they breathe with their diaphragm, they're getting that beautiful pelvic floor lengthening. And once you've released your bicep curl, then you can build strength.
Yep. And then lastly, just making sure to give the verbal cues to your patient of you should feel the squeeze and the lift coming not just from like the rectal tissue or the glute squeeze, but also from the clitoris and urethral area, especially if they're having urinary dysfunctions. So try to customize it for your patient instead of just giving them the handout and sending them on their way, because most likely it's not going to help them.
Totally. And so we're sharing with you today some information from our digital clinician resource binder, all about Kegels. And so you can pause and take a look, and these are cues that Melissa and I use in clinic all the time and often are quite helpful for people, and always a good idea to, lie down, as it says right there. It's a lot easier to not have any of the other muscle groups start to take over for the pelvic floor. And if you're lying down, the glutes aren't working, nothing else is working.
And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and let us know your biggest challenges with caring for your patients who have difficulty doing Kegels.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam.
When you get your free guide, you'll also get access to our weekly newsletter full of real pelvic health education you can use with your very next patient. And we're thrilled to announce our AANP accredited online course is now open for enrollment. See the link to enroll below.
Our AANP accredited online course Beyond the Kegel, which you guys helped us to come up with that name. Thank you so much. Is 6 modules packed with practical information that you most likely didn't get in your training. You'll get videos, templates, patient education handouts, like the one you just saw in both English and Spanish, hands-on demos, everything you need to confidently help your patients with pelvic floor dysfunction. Sign up for Beyond the Kegel to improve patient outcomes and your provider experience.
Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.